Um, well, welcome everyone. I'm Jenny Miller, the Executive Director of the Global Climate and Health Alliance. I'm very pleased to welcome you to the Climate Action Network Big Tent call on climate and health. And welcome both to CAN members, and I understand that we have some folks joining us who are not part of a Climate Action Network, so welcome to you as well. I want to note that translation, Spanish English translation, is available. To access translation, click the globe at the bottom of your screen and select the language that you'd like to listen to this in and interact in. So we're having this call because health is really fundamental to why we need ambitious climate action. It's a fundamental rationale for why all of us should be and are working on this issue. Has the potential to be a driver of much more ambitious climate action. It puts a human face on the issue. It personalizes it, makes climate change something that's really relevant to you, to me, to everyone thinking about their families, thinking about their communities. In addition, we know that many of the actions that we need to take on climate change, both in the mitigation and adaptation space, can offer additional benefits beyond just the prevention or adaptation to climate change, can offer additional gains for health and actually help offset the costs of taking those actions by reducing the impacts of air pollution, for example. I think because of all of this, momentum has been gathering on climate and health in both the UNFCCC space and within WHO, World Health Organization processes. Health was mentioned in the UNFCCC convention itself and is mentioned in the Paris Agreement. We've also seen growing discussions of health as a climate impact in the loss and damage context, as well as the adaptation need to protect people's health, well-being, and their lives. Most recently, as I'm sure many of you know, at COP28, there was the adoption of the COP28 UAE Declaration on Climate and Health during Health Day, the first ever Health Day at COP. And that declaration has now been endorsed by 150 countries. So that's 150 countries around the world within the UNFCCC context, recognizing the importance of health in our work on climate change. In WHO spaces, climate change cuts across multiple streams of work. It's now due to be embedded in WHO's strategic plan. It's being integrated into the general program of work that will define WHO's work from 2025 through to 2028. And towards the end of next week, we're anticipating the adoption of the second ever World Health Assembly resolution on climate change. So that would be adopted by consensus by member states at the World Health Assembly. So it's clear that these intersections of climate change and health are becoming more felt in every part of the world. And in all of these discussions, I think some of the driver of that is we're actually unfortunately seeing those impacts on health in every region of the world as the climate crisis ramps up, as we're seeing greater climate impacts. Communities are feeling the impacts of heat, of storms. Health systems are feeling the impacts. So it's becoming very, very evident at a very granular level, as well as showing up in these major kind of fora of discussion. However, I think at this point, we've seen these kind of acknowledgements, these declarations, these kind of commitments that are sort of symbolic and important in a symbolic way. At this point, it's really actually essential that we move from acknowledgement to action. and really integrating health into climate action, driving much more ambitious climate action, driving those climate actions that protect health, whether or not they reference health, and also ensuring that climate policies that have the potential to greatly benefit health are the policies that are selected over and above others. All of that, of course, has to be supported with appropriate finance and the accountability and follow through. So for all of those reasons, we're really delighted to be co-hosting this CAN Health Working Group, this webinar. The Climate Action Network Health Working Group has organized this. GCHA has been involved with that working group and is very pleased to be a part of that work. And we're very delighted to be leading this webinar today and engaging all of you in this conversation. With that, I would like to pass off to Pooja Dave, the policy coordinator at Climate Action Network International, to welcome us and set the stage from a CAN perspective. Pooja, over to you.
Thank you, Jenny, and hello, everyone. For those who don't know me, many of our CAN colleagues already know me, but I am Pooja, and I work as policy coordinator with CAN, especially on different policy aspects that we deal with in our work and day-to-day life. And actually, Jenny very well articulated that why health is so crucial. It is so important. It is fundamental, and we cannot ignore it. And it gives the human touch and the human face that is really required when we talk about climate change. Just to add more to it, we are here from different regions and different continents. And at present, all of us would be able to list one or the other climate impact or climate-related impact that we are experiences few kilometers away from where we stay, at our home. Some are in between impacts that is happening right now. For example, in Canada, it's the season of wildfire. Back in India, we are experiencing heat waves. Africa just saw floods in Kenya or drought in other part. What happened in Dubai over past month also all signifies that how many into momentum and into scale the climate impacts have been being experienced and how aggravated they have been over the past few years. And when we talk about climate impact, we cannot absolutely ignore health, because when an climate impact is happening or post climate impact, the one thing that gets extremely challenged is the health and health infrastructure. And as very rightly pointed, that health is not something that has not been realized. It is part of the convention. It was part of the Paris Agreement, but it was never politically elevated to a level or being negotiated in a way that it realized that it has such strong connection with what work we are trying to achieve as well. It is important to build resilience and protect the vulnerable community as well. So understanding the significance of health, CAN over last year realize that we need to set up a very strong health working group for us that can come up with strong strategies, that would come up with action plan that how can we incorporate and build those bridges that connects everything on health as well, and bring different communities together that are working on health as well. It is not that CAN is an expert on health, but we know there is an entire health community that is outside CAN that can really support the work that we are trying to do, and we can collectively grow and integrate health and ensure that it gets part of the whole climate policy work that we are trying to do. And realizing that, we set up an health working group, and as very rightly said, that Global Climate and Health Alliance and Healthcare Without Harm really supported that. And Jess and Shweta, who are also part of the on this call, are co-coordinating that working group and ensuring that we don't miss health on any other front. What is also crucial for us to see right now, that while we got an health declaration or health ministerial for the first time at last COP, that particular thing is not enough. It was a start and a much realization that had to happen, but we need to do much more to ensure that health is integrated as part of the negotiation and becomes a negotiation agenda as well. Because without having conversation on health and human life, I don't think we can move towards a just world that we are trying to achieve through whatever work we are trying to do. There are several low-hanging fruits as well currently where health is finding its place. One of them is on adaptation, and some of you who are working in that field would know that last year we got the framework adopted on global goal on adaptation. It has its new terminologies called as UAE Climate Resilience Framework. And as part of that work, what was identified are 7 different thematic targets, and health is one of those targets. What is now going to happen in that term is that over next 2 years, the community will work together to build indicators so that we can assess and determine progress on this front as well. That becomes part of all the work that we are trying to do on adaptation. So that is somewhere where health is seen as a strong entry point, and quite few health community is involved in articulating those indicators and what those success indicators look like, and ensuring that they are just equitable in nature as well. With loss and damage, obviously, that is the most primary thing that we need to talk about as well. So yes, when we talk about climate impacts, health definitely is seeing its foot and trying to bring things together. But the other part is that when we also talk about climate mitigation, when we talk about transitioning away from fossil fuel, health has an important narrative over there, because the fossil fuel industries and the emission for fossil fuel industries have health impact as well. They have quite some impact on the respiration and cause other respiratory diseases. And hence, when we put our narrative together in terms of transitioning away from fossil fuel, health is an important segment in it to consider. And that's why those transitions needs to happen in a just manner and considering human life of it as well. So this is how all of the pieces come together when we talk about health, and health is very central and fundamental to when we talk about climate change as well, and in bringing about ambition to climate change. Thank you. I think I will hand it over back to Jenny.
I'm actually going to step in. Thank you, Pooja. My name is Shweta Narayan. I'm one of the coordinators of the CAN Health Working Group, along with my colleague Jess Weekly. And I think between Jenny and Pooja, we have really set the context quite well. I'm just stepping in to give you a sense of what the discussion today would be, and I'm going to request everybody who's on the call to just type in the text what does climate and health really mean to you, because that will give us a good sense of how we see the intersection of climate and health. And as Pooja rightly said, health is foundational in terms of its consideration and can really determine the even the equity and justice component in the solutions and the actions that we are pushing and convincing our governments and policymakers to take. Today's webinar has 2 amazing panel discussions. The first one is and my colleague Andrea will take off from here, would be the big picture narrative. And the second panel discussion will be on some of the immediate opportunities that we are seeing with World Health Assembly and the UNFCCC SBs in Bonn, and in that context where we can look at climate and health opportunities and interventions. So without much ado, I'm going to pass on to Andrea Hurtado Epstein, who's the climate manager from Latin American region in Healthcare Without Harm, and has a tremendous experience on climate, environment, and health policies, working with governments and regional leadership. Andrea, welcome, and I look forward to the conversation.
Thank you so much, Shweta. And good morning, everybody. Good afternoon, maybe good evening to some of you. It is a real honor and pleasure for me to be here. As Shweta said, my name is Andrea, and I'm with Healthcare Without Harm. I run the climate program for Latin America. And I'm very excited to introduce you to this amazing panel that we have today. But before I do so, let me give you a little bit of context of what we're going to be discussing over the next 40 minutes or so. In this panel, we're going to delve into the urgent call for ambitious and health-promoting climate action, especially transitioning away from fossil fuels, but not just as an environmental necessity, but as a fundamental health and humanitarian imperative. With a special focus on youth engagement, we are going to explore the vital role of young leaders in advocating for and driving transformative change towards a sustainable future. Key to our discussion is the recognition that the continued reliance on fossil fuels not only perpetuates environmental degradation, but also poses dire health risks to communities worldwide, as we have already heard from Jenny and Pooja. From air pollution-related illnesses to the exacerbation of climate-related disasters, the health impacts of fossil fuel extraction, production, and consumption are undeniable. However, in our pursuit of solutions, we must be vigilant against falling into the trap of false promises. Geoengineering, carbon capture technologies, and others, while touted as quick fix solutions, often come with unforeseen consequences and can divert attention and resources away from more sustainable, community-centered approaches. So by centering youth voices and emphasizing grassroots engagement, we aim to chart a course towards a just transition that prioritizes health equity, social justice, and environmental integrity. So with that context, let me now introduce you to our amazing all-female panel. I would like to start with Dr. Jamila Mahmood, who is the Executive Director of the Sunway Center for Planetary Health in Malaysia. She is a trained medical doctor, a humanitarian, and a planetary health advocate. Previously, Dr. Mahmood served as Undersecretary General for Partnerships at the International Federation of the Red Cross and Red Crescent Societies, and was also the Chief of the World Humanitarian Summit Secretariat at the United Nations. Welcome, Dr. Jamila. We now have Lily Furr, who is the Director of the Fossil Economy Program at the Center for International Environmental Law, CIEL. She leads a team of attorneys and campaigners working to address climate, biodiversity, and pollution, including by exposing the risks of false solutions. Welcome, Lily. And last but not least, we have Winifred Akello, who I will call Winnie, if I may. She is a final year student pursuing an undergraduate degree in veterinary medicine at Makerere University in Uganda. Witnessing the complex interconnection between humans, animals, and the environment, and the ripple effects of climate change on their health and well-being, makes her advocate for a world where everyone is united regardless of discipline to address the various health challenges affecting our planet. She's also a climate and health advocate and a member of the Youth Climate and Health Network, as well as START Foundation. Welcome, Winnie. So if I may, I will ask you to try and keep our our answers short and concise, because I have at least 2 questions for each of you. And I would like to start with Jamila, if I may. So Dr. Jamila, as a distinguished humanitarian, medical doctor, and a passionate advocate for planetary health, could you elaborate on why every individual should feel a sense of urgency regarding our collective well-being? In light of the escalating climate and nature crisis, could you provide context on how these challenges directly impact our health and emphasize the importance of immediate action, especially around a just transition away from fossil fuels? Dr. Jamila, the floor is yours.
Thank you very much. As a long-standing humanitarian for more than 2 decades, I have witnessed firsthand the impact of climate change on people's lives. And undoubtedly, the ones who are the most vulnerable feel the impact the greatest. And ultimately, it is about, where you are in the social ladder, equity, access, all these contribute to whether people are healthy or not. It has become urgent, and I think we don't need to look too far back, but just recall the time of the pandemic where everyone was impacted and we could not get out of it unless, no one is safe until everyone is safe. And I think that sense of health now being a security issue is a very important aspect. And many times health is seen as a consequence, but actually health is central to our lives. Without health, you can't move economies, you have social disruptions, and of course, sometimes you have loss of life. Now, while climate change was seen to be something maybe where the poorer countries would be impacted, we are seeing now that heat waves, global warming are also impacting countries that are developed, and seeing a lot of morbidity and mortality from that as well. And not only from heat waves, but also flooding, the impacts of climate change on hydrometeorological disasters. And all this is going to affect everyone, rich or poor. Ultimately, we need to look at the driving causes of these impacts. And as someone who was a humanitarian for many years, I honestly got really tired. I felt that I was putting Band-Aid on gaping wounds. And you need to look at the systems, you need to look at the drivers of this change. And it is us, our choices, the choices we make, the things we decide to consume, the way we decide to travel, how we decide to take our packaging. So fossil fuels drives a lot of these changes, and without a doubt that, you know, until and unless we have a just and safe transition, we don't have time. The clock is ticking very fast. All the scientific data points to a world that's warming faster than it should. And as someone living in Asia, Asia is extremely vulnerable and warming up faster than any other region in the world. Now, of course, there's also issues like infectious disease spread, you know, when you're seeing now tropical diseases happening in the US and Europe. So these changes, the glacial melts, the melting oceans, and inevitably you will see the displacement of more than 1 billion people by 2050. Where will these people go, and how will they also get access to health? So anyway, it's without doubt, health is crucial to life. Health is very severely impacted by climate change.
Thank you, Dr. Jamila, and thank you for reminding us. Obviously, it's something that we seem to have forgotten, but it wasn't that long ago that we saw with the pandemic, as you very rightly said, no one is safe until everyone is safe. And there is a profound intergenerational component to that saying, which brings me to Winnie now. Winnie, could you elaborate on the pivotal role that young leaders are playing in driving climate action and ensuring governmental accountability, including a just transition from fossil fuels to renewable energy, in the context of what Jamila has just presented to us all? Winnie, the floor is yours. And we can't hear you though. Let's check your mic.
Hear me now?
We can hear you now. Thank you so much. Go ahead.
Okay, thank you. Yes, young people are agents of change in their communities and are driving solutions to climate change. They are creating positive change in their communities through various youth-led initiatives that operate at grassroots levels, and they spearhead projects that promote sustainability. And some of these initiatives organize educational programs and campaigns to raise awareness on climate change and empower fellow youths and community members with knowledge and skills they need to take climate action. Yesterday, we organized a workshop on climate change and vet medicine at my college here, which was aimed at empowering vet students to actively get involved in climate action. We started this initiative after witnessing the absence of active participation of vets in the global dialogue during COP28. It was really disappointing, I can say, because vets are essential health workers which work at the intersection of human health, animal health, and environmental health, which make their voices in the climate decision-making very crucial. We conducted a research among the vet students, and we found out that actually most of the vet students, they are unaware of their roles in climate change, but most do believe that vets have a role to play in enhancing climate change, enhancing climate action. Young people are eager to take change and are willing to do whatever they can do for the health of our planet and its inhabitants. Through the various youth-led movements, young people have succeeded in bringing to global attention to the urgency of climate action and have continued to put pressure on governments and corporations to transition away from carbon-intensive practices and continuously encourage them to embrace renewable energy sources and cleaner technologies. Young people are also utilizing the power of social media to amplify their voices, mobilize communities, and educate people about the climate crisis, and stand with the communities that are negatively impacted by the climate change. As we heard in the beginning by Pooja, who was saying who talked about the recent floods that Kenya experienced. Last week, there was a social media storm that was organized by Third Foundation, and I got an opportunity to participate in this storm, whereby during these floods, many lives were lost. Infrastructures, including healthcare facilities, farms were destroyed. Many animals lost their lives, including livestock, which is a source of livelihood for many of the households affected. And this creates a huge threat to food security and poverty eradication. And this in turn affects their health and well-being of the individuals that have been affected by this crisis. Because when we talk about health, it is not merely just absence of diseases, it is also about the economic well-being, about the social well-being, and the good mental state of the individuals. But all these are being affected by the extreme weather events that we are seeing happening now. Climate change means more loss and damage and more health emergencies, and it is a health crisis. So we young people, we use these social media platforms to spread out these messages to wider audience about the urgency of the matter and call upon international support for the affected communities. Also, in our advocacy, we young people, we emphasize the significance of just transition that should consider inclusion of everyone, where no community should be marginalized and no voice should be left unheard as we transit away from fossil fuels and adopt renewable energies which are cleaner, cheaper, and eco-friendly. Overall, as I conclude, young people are very instrumental in fostering climate action and pushing for systemic change and ensuring that transition to renewable energy is equitable and inclusive. There are innovative approaches, unwavering commitment, and ability to mobilize diverse communities, make them crucial agents of change in the global efforts to combat climate change. Thank you.
Thanks to you, Winnie. Thank you for bringing up what we've come to know as the One Health approach, but really what it is nothing other than our understanding that our health as humans really does depend also on the health of animals, plants, of the environment that sustains us. And it does build on what Dr. Jamila was saying, right? No one is safe until everyone is safe, and that very much includes the other living beings with which we share this planet. Thank you also for bringing up the role of young people, particularly how they come at the change that needs to happen at a structural level from an innovative and unbiased approach. And in that context, allow me now to go, please, to Lily. And Lily, amidst discussions on phasing out fossil fuels, because we haven't been coming at this from this innovative and unbiased perspective, but rather from the perspective of large lobbies, large interests, there's considerable mention of technical solutions such as carbon capture storage, geoengineering, and other false solutions. Skepticism and concerns surround these approaches. What factors contribute to the skepticism? And in your view, what solutions would promise in addressing our pressing fossil fuel dilemma? Thank you, Lily, over to you.
Thank you so much, and greetings from Berlin, Germany, and sending solidarity and strength to everyone who directly or indirectly is experiencing extreme weather events and climate impacts right now. That is heartbreaking. So the factors that contribute to skepticism around dangerous distractions and techno fixes are basically science, common sense, evidence, and a healthy amount of alert for industry greenwashing, I would say. So the specific technologies that you have mentioned already. So on the one hand, carbon capture technologies, so carbon capture and storage technology that's been around for decades is a proven failure. It's never really worked to reduce emissions, and it's not going to work in the future, but we keep pouring public subsidies into that instead of into the real solutions. At scale, it poses overwhelming technical challenges and real safety risks, and is a lifeline for the fossil fuel industry right now. It's not a climate solution. It's about getting more oil and gas out of the ground through enhanced oil recovery. That's another word for basically the same technology. And on the other hand, geoengineering, mega scale, planetary scale technological interventions to counter some of the symptoms of global heating, either by, supposedly sucking carbon out of the atmosphere and storing it safely, or by manipulating the amount of sunlight that reaches Earth. Those are highly speculative, unproven technologies. Governments the vast majority of governments have agreed to put a global moratorium on these technologies. Some of them are banned. There's ongoing conversation around additional restrictions for their use. The majority of scientists has said no to the use of solar geoengineering as basically a non-solution to the climate problem. But we keep seeing proposals for more research, outdoor experimentation, commercial uses of these approaches, because the urgency of the climate crisis is accelerating, and that brings to the table all kinds of strange solutions. And health arguments are really important, and I see at least 3 links between health and these techno fixes that we tend to call dangerous distractions, because they distract us from phasing out fossil fuels. So the first one is that they lock in fossil and other polluting industries. They meant to prolong the lifespan of, for example, chemical plants that produce plastics or ammonia for fertilizer use. Second, they cover up expansion for fossil fuels, so they basically exacerbate climate harms and health risks if we, prolong the lifespan of fossil fuels and give the fossil fuel industry a cover up for expansion. And third, they introduce new industrial infrastructure that involve the use of more toxic chemicals, which as petrochemicals are basically also fossil fuels in another form and bring their own health risks. So the key solutions, are obviously based on everything that we've heard on this panel and before, phasing out fossil fuels as fast as we can. And that means not just the use of fossil fuels in energy and transport and electricity. It also means that we need to think about the whole petrochemical sector, because that's where the fossil fuel industry wants to grow in the future. And their main products are plastics, we've had packaging already, single-use plastics, but there are also agrochemicals, toxic, fertilizers and pesticides. Those are fossil fuels in another term. So we need to really focus on near-term emission reductions. We're way beyond the point where we could deal and manage carbon emissions. People are proposing carbon management solutions right now. That's nonsense. We need to, deal with fossil fuels, not with the emissions that they produce. And on top of that, we need real careful ecosystem restoration, not a geoengineering scale, carbon dioxide removal. So real solutions, not false solutions, no dangerous distractions, and really a focus on phasing out all fossil fuels.
Lily, thank you so much for bringing in a truly systemic perspective. I think I would call on what the UN Environment Programme has called the triple crises, because we do need to consider the interactions between not just the climate crisis, but also plastic and other types of pollution of air, soil, and water, and of course, biodiversity loss, massive biodiversity loss that we're seeing, and keep health at the center of all solutions that we come up with for these triple crises. And allow me to have that general consideration for our next round of questions, which you might all want to answer in some form or another. But because we're in this conversation with a few colleagues from the CAN family who might be new to the health considerations around climate action, let me go to Dr. Jamila first. How do you envision the health sector leveraging its trusted and credible voice to bolster climate action on a global scale? And I'm thinking of the health sector as not just economic power, which is massive, and its political influence, but mostly its ethical influence and clout. Dr. Jamila?
First of all, I'll talk about the good stuff, right? I think that you're right. The health sector writ large has a larger trust factor, particularly after the pandemic. Nurses are probably considered the most trusted people. followed by other healthcare professionals. So I think we have to leverage that trust and use our voice to convince people of the very intricate link between the health of our planet and our health and the health of every living thing on Earth. Now, the challenge, though, is that the health profession is also to be blamed. If you look at emissions, the health sector is responsible for 5% of greenhouse gas emissions. So what was said earlier about the use of plastics, what kind of energy is actually fueling our health facilities? How are we looking at, whether it's scope 3 emissions or scope 2 emissions? So I think that, the health sector has to radically transform. And it can only do this if it is enlightened and understands its impact, not just as polluters, but also as potential, advocates, and using their voice to push for, divergence from fossil fuels, moving towards a just transition. Now, how can we do this? First of all, the challenge is that only 15% of medical curriculum has climate in it. So we need a radical transformation of education. Secondly, we need to really work with the ministries and the stakeholders to say it makes a lot of sense, not just in terms of reducing your emissions, but also economic sense for health ministries, health facilities, private health sector to start decarbonizing, and we give them the tools and the training. Now, is this possible? Let me share my own experience coming from Malaysia and running a planetary health center. We have managed to convince our government to include planetary health in our national development plans, but also the Ministry of Health to partner with us and Healthcare Without Harm to look at decarbonization of the health sector. The other thing that we're doing, which is quite big, is developing a national planetary health action plan in Malaysia, the first country in the world to do this. Why? Because ultimately health, 80% of determinants of health are outside the health sector. We forget this. It's not a medicalized sector. If you only have to depend on medical treatment, then you're going to go down a rabbit hole of constantly trying to chase for new solutions to disease, when what we should be doing is preventing people from falling sick. And that means, a move away from fossil fuels, looking at access, equity, looking at social determinants, environmental determinants, and political determinants as well. So I think that, having a multi-systems approach is going to be critical. I think what was mentioned about plastics, it is that last mile of fossil fuel use. And, the fossil fuel industry will protect it at all costs. Watch out, this is coming. As we talk about, removing plastic from our packaging, our everyday lives, they will come at us. And I think the only way we have a chance is when health professionals stand up and speak up, because every fossil fuel giant CEO has a doctor he trusts.
Absolutely. That everything you just said is key. Thank you so much for bringing that up, and also for mentioning the role of the health sector and in its need to lead by example, right? Because it is also responsible for a large portion of global emissions, and it shouldn't just be transforming to adapt to the many impacts of climate change, but also to reduce its own emissions. And as you very well said, that leading by example comes from both at the policy level, with ministries of health and others leading the way, and health systems leading the way, but also from the health professionals' perspective, which would lead me to a second question for Lily, because you've mentioned all of these dangerous distractions with all of these potentially dangerous technologies that are being discussed at the moment. How do you think, Lily, that leveraging the voice of health professionals and of the health sector, of the health community more widely, support your efforts to counter these arguments from the industry, and but also help them envision new solutions that are community anchored, that are equality anchored?
Thank you for that question. And I'm going to also include in my answer a question that was flagged in the Q&A in the chat here, in terms of This being potentially unfair and too much of a burden on some countries to phase out fossil fuels very, very quickly while people depend on that. I think it's a matter of equity and fairness, that the transition away from fossil fuels that we need is it's not just a full one and a fast one. It also needs to be fair and funded, meaning rich, developed, industrialized countries have to move faster, and they have to provide climate finance for the transition. But we also need to recognize that right now, many communities are not benefiting from those oil and gas and other fossil fuel projects anyway, and they're bearing the brunt of the harm, not just from global climate impacts, but also from the local impacts of extraction, including on health. Because when we look at fossil fuels, and you framed it as a triple, planetary crises, it's not just about counting tons of carbon that they add to the atmosphere, right? When we look at the fossil fuel problem from a health angle, it also points to non-climate harms and other aspects of that problem, and also leads us to think about more holistic solutions. I just want to point out that, interestingly, bringing it back to the sort of false solutions piece, that the UN Special Rapporteur on Toxics and Human Rights, Marcos Orellana, he had a thematic report in one of his annual reports on the toxic impacts of some proposed climate change solutions. We also looked at technologies, carbon capture technologies like direct air capture, and really pointed to the fact that some of these emerging proposed technologies and so-called solutions actually bring a heavy toxic pollution burden and would increase the use of toxic chemicals, and that we shouldn't pin our hopes on these unproven technologies and actually need to deal, with the urgent crisis at hand. And I think where we can see that very, very clearly is also with a technology like carbon capture and storage. We're right now fighting that technology as, a greenwashing strategy of the fossil fuel industry. And we're right now still mainly fighting on climate grounds and arguments, saying it doesn't actually help to reduce emissions. It prolongs fossil fuels. It doesn't address the climate problem. However, when you broaden your lens and you speak with health professionals about the risks of carbon capture technologies and the use of chemicals in those technologies, for example, amine-based solvents are used in carbon dioxide technologies, and carbon dioxide itself is a toxic gas, and it can cause lots of health issues for people when CO2 pipelines leak or potentially burst, which has happened in the past. So when you speak to health professionals, you realize that the problems with these so-called solutions goes way beyond the climate bubble, and is not just a question of the tons of carbon not adding up. They're actually not good solutions because they make other problems worse, including environmental injustices for local communities and health issues, but also to a certain degree for some of these technologies, the biodiversity crisis. So I think we need many more health professionals as experts to speak out, and as advisors in our campaigns to advise us on the arguments that we can use. And they need to speak to political decision makers directly and share their knowledge about the health impacts of what these, dangerous distractions bring, and assess, the real solutions that we need from a health perspective. So I'm really, really excited about some of what I've heard here in this webinar, and very, very positive about ongoing and future collaborations in these spaces. Thank you.
Absolutely, Lily, and thank you again for reminding us that just transition away from fossil fuels and extractive industries in general needs to be full, fast, fair, and funded. Otherwise, if we don't keep the human rights and the health-centered perspective, and thank you also for bringing up the Special Rapporteur report, we risk reproducing, again, the same mechanisms that have excluded people, and we will continue to have people pay for the externalities of these industries with their lives and with their health. Which brings me to a final question also for Winnie. Considering the interconnected nature of all of the crises that we have been discussing, both social and environmental, and also the interconnected nature of social movements. What forms of solidarity and support do you believe are crucial from other movements to bolster youth-led initiatives effectively, especially when opposing giants of industries such as the fossil fuel industry? Over to you, Winnie.
Well, thank you very much. In the interconnected world of social movements, I believe our strengths lie in unity and collaboration, because when it comes to climate crisis, there is an understanding gap between the young people and the adults, because the way the young people perceive climate change is not the way the older generation perceive it. But young people are willing to collaborate and work with the adults to mitigate climate change and its impact. Collaborative advocacy, I believe, is very crucial, because we must join forces across generational movements to create powerful, unified campaigns, policies that address our common shared goals of saying no to fossil fuels. I think we should also considering cross-generational solidarity is very important, because when adults join youth-led protests and campaigns, it signals a broader support and enhances legitimacy of their efforts. I also believe capacity building and empowerment of youth are very important. Offering trainings, fellowship programs, mentorship, strategic planning, and leadership skills can empower the young people with the tools they need to engage with the government and other decision makers in driving climate action. Also, I believe resource sharing is another crucial form of support, because established movements can provide financial support to youth-led initiatives, fund their campaigns, grassroots projects, and sustain their long-term efforts. Also, providing platforms for young people to share their perspectives and increase on their visibilities and influence, as this will demonstrate a united front across generations and movements. Lastly, I believe institutional supports are very, very crucial from NGOs, universities, because institutions can support youth-led initiatives through endorsement of their projects, and this creates credibility and weight to their efforts of climate action. So by embracing these forms of solidarity and support, we can enhance the impact and sustainability of youth-led initiatives. These collective approaches, I believe, not only strengthen the fight against fossil fuel industries, but also build a more resilient and inclusive movements for systemic change. Thank you.
Thank you, Winnie. I absolutely agree. And this brings me to, we're running out of time now, sadly, because we could continue with this conversation for a long time. But I would like to give you three the opportunity to have a final statement. And it seems to me that what I'm hearing from you is that in the face of these multiple and compounding crises, we don't just need to transform our energy sources, we need to profoundly transform the way we conceptualize health and well-being. And thank you, Winnie, because you were also one of the people who brought up mental health as part of this integral conceptualization of health. So in that context, what do you think we could do to bring together the different movements that are working towards justice in all contexts, not just environmental justice, but also social justice, climate justice, health justice, of course. How do we bring them together to work towards our single shared goal of this new outtake on what health should be, what well-being should be in the future? And because we don't have a lot of time, I will give you all a minute tops to answer that very easy question that I just asked you. Can I start with Lily first, please?
Thanks. So I think I want to call really on the climate movement to broaden the ongoing fight to end fossil fuels, to really include the whole suite of fossil fuels in the wider fossil economy, including petrochemicals, plastics, agrochemicals, to really have a meaningful impact. And I think I want to encourage us to, to really collaborate closely with health experts and professionals to come to a shared narrative and understanding on how we talk about the interlinkages between fossil fuels and health, and speak with one voice and become really strong advocates and share our campaign strategies so that we can learn how we can have the most meaningful and highest impact across the board. Thank you.
Yes, learn from each other, speak to each other, share strategies. Thank you, Lily. Winnie, can I go to you now?
Oh, yes, thank you. I believe the way I discussed before, we should embrace the interdisciplinary teamwork. We should, because climate change is a One Health issue, and all health experts must come together and speak a common language of saying no to fossil fuels and yes to renewable energy, because most of the health workers, the medics are, I can say they're already catching up with the climate discussion. But then other health workers, like us, the vets, we are really not so much more informed about the bigger picture of our involvement, how climate change impacts us, because we live in an interconnected world and we all have to work together. We all have to come together and have a common say, have a common goal as we mitigate the climate change impact. Thank you.
100%, Winnie, thank you for saying that. And absolutely, we do need to build the capacity of health professionals worldwide so that they can become the most effective climate advocates. And that includes obviously all health workers, including veterinarian professionals. That will lead us to the last word from Dr. Jamila, please.
Yeah, I'm going to try to be a bit more provocative. I think that we have to see and learn on what has created social movements and what has actually, what can we learn from history where change happens. And you will realize that change happens not because we speak about it. Change happens when there is a political will and political pressure. So are we speaking to the right people? And I think we've got to learn to speak to parliamentarians who in the end, push for change in parliament. The second is really pushing on, more linked up, transdisciplinary policies, which means we have to start leaving egos at the door. Everyone wants their own little favorite thing to move forward. But how do we find common ground and put humanity at the center of everything and then work from there? And the third is pressure, the 3 Ps that I call. The third pressure is that we can't let go of that pressure point and, keep our feet onto that pressure accelerator. And this is where you need young people, older people, women, you need savvy communications, clever social media, and not just throw evidence and data at people. I think the narrative has to shift from one of doom and gloom to one of hope for the future. The next time you talk to a group of people, tell them to take out the photo that is about love in their phones, and ultimately it's usually their children or their wives, and then remind them that what they do will impact the ones they love the most.
Wow, thank you. That is such a powerful way to finish this panel. Thank you, Dr. Jamila. And we should absolutely not be afraid to speak truth to power, to get involved in politics and in policy, to make sure that we are addressing the right decision makers. And on that note that you were just saying about making it about love, making it about hope, it's also on us to start building those solutions, those alternatives, so that when the fossil fuel industry and others tell us that there's no alternative, we cannot change because we don't have other options, we're showing them that they're already existing, they're already happening in our communities. We have solutions, and there is reason to hope. Thank you, Dr. Jamila. Thank you, Winnie. Thank you, Lily. This has been fantastic. I would very much love to continue this conversation, but I'm hopeful that you will stick around, that we'll be able to answer some of the questions that have come up in the chat. It's been fantastic to moderate this conversation. Thank you again. And I will take it back to Shweta, I think, for our next panel.
Thank you. Thank you so much. This was just such an amazing and inspiring conversation, and just, I mean, beautifully laid out in terms of the big picture context that we wanted to set in terms of the challenges that we are seeing on climate and health. This panel, and this is what I was explaining in the beginning, that we have split this conversation into two parts: the big picture and some of the policy opportunity and role of policy in translating the hope and the solutions into reality. So in keeping up with the tradition of having super powerful all-women panel, our next panel is also an amazing set of panelists and experts that I have the privilege to host and moderate this conversation today. We have Alessandra Nilo, and I hope I'm pronouncing your name correct, Alessandra. Welcome. Alessandra is a feminist, a journalist specialized in communications and health, and has graduated in diplomacy and trade affairs. She's the co-founder of Gestos, HIV and AIDS, Communication and Gender, an NGO created in 1993 in Brazil that has followed the G20 process since 2011. Alexandra is currently External Relations Director for Americas and the Caribbean at the International Planned Parenthood Federation, and she's also the Sherpa of the C20 in 2024 in the G20 process that is hosted by Brazil. So welcome, Alessandra. We also have with us Rosie Tasker, who is a Clean-Air Liaison for the Global Climate and Health Alliance. She's been working to support the civil society organization engagement in the preparation for the World Health Assembly resolution on climate and health, and has also been keeping track on other key policy, climate and health policy processes in Geneva. And last but not the least, I have my partner in crime in the CAN Health Working Group co-chair, Jess Beakley, who is the policy lead for the Global Climate and Health Alliance, and also supports the health community to understand intersections between health and the UNFCCC processes. So a very warm welcome to all of you. And I have some questions to kickstart this process. So I will, my first question is to you, Alessandra. As a C20 Sherpa, how are you seeing the intersections between health and climate being addressed in both the G20 and C20 spaces and as priorities? Because these are really, really incredibly important places for decision-making and for policymakers. And especially with now Brazil's leadership and the priority focus on vulnerable population, how are you seeing the climate justice and health equity conversation playing out?
Thank you, Sweta and colleagues. Thank you very much for having me here. I will try to give you a very short update on this conversation. I think the first thing is to consider that this is a particular momentum to all of us at the civil society, because in the G20 we have in the Global South 4 presidencies in a row. So we had Indonesia, we had India, now Brazil, and then South Africa next year. And for those that don't know, the G20, they work with 2 tracks. So one is for finance, and the other one is the Sherpa track, where we have those other issues. Finance is really the key agenda for the G20. So I will also focus my intervention on updating you on that. This is the first time that we'll have within the Sherpa track the issue of climate and health included in the health working group. And it is one of the 4 priorities that Brazil established. And it is particularly important because, as you know, Brazil will be hosting the COP30 next year. For the C20, which is the civil society engagement group that works to put forward recommendations to G20, we start talking on health as a fundamental issue within the G20 in 2014 in Australia. And we also said that is, the social and economic pillar, thinking on how to will be the way also to address inequalities and to produce and promote inclusive growth. So we always try to link the health and finance means of implementation, showing how it impacts each other agendas. In 2015, same year that we approved the SDGs, we start asking the G20 to increase financial needs for climate adaptation and mitigation, including that pledge, the health preparedness, because we saw the countries continue dedicating billions of dollars on fossil fuel subsides. And this has been one of our consistent messages that we really need to shift in these subsides to renewable energy, energy conservative, etc., because the impact that we just saw in the last panel, so I'm not going to address that because I think it was very well covered. On that, I'd like to highlight also that we are particularly concerned about the role played by private sector in this regard, because they are, particularly the big corporations and big enterprise, they are really impact on both health and climate. And we need really to find a way to regulate them. Besides that, the other concerns that we are addressing here in the C20 is that in terms of how to fund those both agendas. So we have been calling attention that public climate finance and health finance will need really to scale up new and innovative sources of finance. But also we have been calling attention to the particular role of public finance on that. So it's not only the private sector coming in and providing funds, which they are not doing, right? So this is something important to say, but also to say we need to have this public sector coming in and funding our agendas. In this regard, and an additional concern that we have is that those public funds that were created, let's just remind us that in 2010, we have the creation of the Green Climate Fund that had a pledge of $100 billion per year that was never met. But in 2022, the IMF created the Resilience and Sustainable Facility Fund, created the Loss and Damage Fund, and the Bridgetown Initiatives, mitigation, global mitigation, and the Trust Fund. So none of these funds have been completely funded. And this is our concern, is that we really need to have sustainable and predictable funds to all these funds together. So we have seen, for instance, some of the funds that are taking innovative approach, like UNFCCC, how it's much easier to fund them, but you also see the importance of funds as the Climate Fund or the Global Fund to AIDS, tuberculosis, and malaria that need to be kept. So we saw that they are saying that we need from $2 to $4 trillion in the next years for climate, but we have a gap around 1 trillion every time. So the count just don't match. In terms of health, and I will finish in 2 minutes, but in terms of health, Brazil is pushing a very South perspective agenda on that. So besides the expansion of health through, let's say, telemedicines and digital health, there is a conversation, particular conversations on that health modality to mobilize additional funds for health. But also, and there will be a paper prepared by the Rockefeller Foundation, and they're planning about having a particular declaration on this area, which is in dispute with the Sherpa track on finance. Brazil also launched an alliance on local regional production, innovative access to neglected disease. There are, as it was said by Jamila before, it was really impacted by social determinants and economic determinants. So it's very important. So to conclude, and just to inform our colleagues, the C20 is preparing our recommendations for be delivered to the governments. Our deadline is to put forward the recommendations on June 20, and we have this meeting on July 4 to deliver both our recommendations. Of course, as IPPF, we are very concerned, and I think we need perhaps to talk more about the relation between climate change and the impact on women and sexual reproductive health and rights, which is one of the key populations most affected during climate emergencies. But also, I think in the economic agenda, in the financial agenda, we are trying to come up with recommendations that are related to means of implementation to all areas, including funds for climate mitigation, resilience, and preparedness, and health in the same way. So recommendations will be related to the role of multilateral banks, tax evasions, the importance of a new tax convention frameworks, how to align the finance for the both agendas with the SDGs, etc. So we'll be really focusing on those synergies, particularly on the economic field. So we are very excited that we have seen this trend of bringing together climate and health. This is a need. We have been saying that for many years, and we are very much looking forward to work more with all of you. All our information about papers, recommendations, etc., will be easily found in our website, which is c20brazil.org. So you are also invited to visit the website. Thank you.
Thank you so much, Alessandra, for just laying it out, the different strands and streams of policy discussions and the nuances and the opportunity that, as you presented, for the health argument and the bringing in the health conversation and integrating it, and not just as a standalone conversation, but like driving some of the decisions in other streams of work. So we are really, really excited to see how this progresses. And as civil society and climate justice and health justice movement members, we are always willing to support you, and we look forward to see what are those opportunities where we can strengthen your approach and provide that solidarity and support that is needed to push a progressive agenda as C20 and in the G20 processes. So thank you so much for your intervention. I'm going to move on to our next panelist, Rosie, and I have the upcoming World Health Assembly Climate and Health Resolution related question for you, given that you've been so closely following this process and also educating the civil society groups on processes of intervention and opportunities that are there. So tell us, how does the resolution, the WHO Global Plan of Action and General Program of Work, address the integration of health consideration into policies within and beyond traditional health sector, and particularly in context to the conversation around transition away from fossil fuels? And what are the key tensions and challenges that are faced during this process? And some of the ways in which they're being navigated, how are we looking to make sure that there is a holistic approach to global health which aligns with various processes and sustainable development goals? So, Rosie, the floor is yours.
Wonderful. Thank you so much for that, Shweta. And it's my pleasure to get to speak to everyone today. I must admit, I'm slightly intimidated by the other panelists. So thank you so much for giving me the opportunity to speak. I think it's a really interesting question. And Shweta, as you say, the World Health Assembly will kick off on Sunday and will run through to the following Saturday, the 1st of June. And over that kind of week of discussions, we'll see a number of kind of key agenda items. And I think probably, as you mentioned, the most relevant are the resolution on climate change and health and the adoption of WHO's 14th General Programme of Work. But I think one thing I also wanted to flag, thinking about that more holistic approach, is that we're also seeing references to climate and how we address climate coming up through the pandemic accord discussions on reducing maternal, neonatal and childhood mortality as well. And I think that's been a really great trend we've seen in more recent years, that actually the touch points between human health and climate change are being much better understood within Geneva. So I think, taking the first part of your question first, I think within this kind of space, we're seeing a lot more focus within the health sector on bringing climate in, but very much centering that discussion on human health. So resolutions at the WHO more generally work to bring together kind of different actors with the WHO and its 194 member states to really kind of help protect and promote human health. And so its core focus has really been the traditional health sector. And I think one of the things that we've seen happening is greater touch points with climate, but this has really been in a piecemeal way. So one of the reasons why the resolution is really exciting and a really useful development is actually what it's trying to do is bring together a lot of these references and these touch points and actually galvanize a much more coherent movement behind it. So we know that WHO has been working on climate change and health for the last 30 years. We saw the previous resolution in 2008, but obviously things have moved on significantly since then. And I think in terms of the why question, the framing, at least within the WHO discussions, has really been about how climate change is undermining progress towards the SDGs. And it's really seen within that kind of broad sweep focus. And so within discussions, we've seen an awful lot of focus on extreme weather, particularly on heat, climate sensitive communicable diseases, dengue, things like that, nutrition and water systems, and increasingly a focus on non-communicable diseases and particularly mental health as a result of climate change. And I think that's been really interesting because it's also shaped the what that we see in the resolution. So when we're thinking about bringing climate into health policies, for the first time, we've got references to adaptation, mitigation, and loss and damage, which is a really great kind of first step to kind of reframing how a lot of these discussions are thought about and engaged with. We're seeing commitments in the resolution on national adaptation plans and vulnerability assessments, the development of kind of more national planning and trying to engage and kind of connect this with other climate strategies nationally. But also kind of a focus on improving that awareness and understanding of both the general public and the medical community. And it was great to hear that being raised so much within the first panel. So one of the key things that will be coming out of the resolution, touch wood if it's adopted next week, will be a global plan of action on climate change and health. And what this will try to do is kind of consolidate a body of technical evidence for governments to sort of look at how the resolution can be implemented, what it is that member states can do as sort of a step-by-step. And so we're likely to see this being developed over the coming year, but what that means for this group in particular is that we hopefully have an opportunity to engage and help shape that. So if anyone's happening to talk to governments over the next few weeks and you're happy to kind of amplify a message, it would be to encourage WHO to consult with civil society to capture those kinds of voices and views that we've got around the call today, because I think it'd be really important. And then the other side of things is obviously GPW 14. So that's the programme of work that will shape what WHO does between 2025 and 2028. And within that, there are 6 strategic objectives. And for the first time, we're seeing climate change and health identified as one of those, which is a huge step forward. I mean, previously, this wouldn't have been considered, and it really is a testament to how that momentum is growing. But we need a push behind that to make that momentum yield as much as possible, and particularly kind of connect across those other policy areas. So under that GPW plan, we're seeing two what are called joint outcomes, which is what WHO plans to work on with different partners. The first is around more climate resilient health systems and addressing health risks and impacts. And that's very much the bread and butter of what WHO and a lot of member states have been doing. So it's focusing on health systems, nutrition outcomes, WASH, vulnerable groups with particular focus on small island developing states, national health adaptation plans, disease surveillance. And I think has focused very much on what traditionally sits within the decision-making of the health sector. But actually looking at how health is then feeding into those broader climate discussions, joint outcome, number 2 is on lower carbon health systems and societies contributing to health and well-being. And that's a really interesting diversion from what we've seen so far, because it's really about reducing the carbon footprint of health systems and supply chains and care services. And I think it picks up on some of those interesting discussions potentially about plastics, but also really quite clearly sets out the leadership role for the health sector in presenting health evidence, helping to accelerate policies, make those co-benefits as ambitious as possible across both mitigation and adaptation. And they talk about within these plans and strategies, air quality, access to healthy and affordable nutritious foods, enhancing environment, physical activity, a lot of those kind of touch points, which are really important. And I think, so the GPW takes a really high level look, seeks to kind of guide the work of the whole organization. And within the resolution itself, we see a little bit more kind of granularity, but more focused on what member states should be doing. And again, within that, we've got a broad commitment to develop and implement national action plans geared towards decarbonisation and ensuring environmentally sustainable healthcare systems, facilities and supply chains, mobilising that high level attention that we need to health impacts through things like UNFCCC Fora, which is fantastic. It's the first time a resolution we've seen kind of really addressing this. And then also promoting inter and multi-sectoral collaboration between government ministries and departments. I think, Shweta, mindful of time, but also I don't want to miss your second question about some of the tensions, because that's also a really interesting reflection on the state of the discussion. There are 3 that sort of jumped out to me looking at the process. And I think the first is the elephant in the room, which is the resolution doesn't mention fossil fuels. We saw a reference to fossil fuels in the supporting WHO report, which helped to frame the resolution negotiations. But we know that for a certain number of member states, a fossil fuel reference was just a red line. And that was a line that cannot be crossed if the co-chairs wished for the resolution to move forward. And I think that really speaks to the amount of political pressure behind the scenes, which has really kind of shaped and pulled apart an otherwise technical discussion. I think in terms of navigating this, it's been interesting to see what the co-facilitators and the core group have been doing. And what they've tried to do is really pull reference to, say, for example, energy and transport into what's directly within the control of the healthcare sector. So when we look at energy and transport references, it's all about reducing waste. And I think that's been an interesting way of trying to navigate around some of those political components with a hopeful view that if we keep maintaining that political pressure, that actually we can get our house sorted internally within health and then be able to engage much more proactively. But it's been really interesting to see how within the kind of hierarchy of government, this resolution and health discussions have been able to get so far and then have been butted back. I think one of the other challenges for this set of this resolution and also GPW was also the challenge of moving outside of the health sector. And actually, this meant health negotiators had to refer back to capital much more frequently. They had to go back to climate change teams, environmental teams, transport teams, energy teams to say, can we agree this, can we not, which has slowed things down significantly. And we know that some of the language is not as strong as we might have liked or has been removed entirely. So we saw planetary references come in and then have been taken out again. Navigating that has been quite frustrating, but ever the optimist, I think actually one thing we can really hope for is that now that those pathways and connections are being better established within the diplomatic side of government, we can hopefully then push for more and get a slightly slicker response, particularly as we're going to see WHO reporting much more frequently on climate change and health as part of GPW 14. And then I think the final tension and it's the perennial one, was around financing. There's a much broader question about how we mobilize the sufficient resources, not only for health, but also for climate. And it's been great to see other speakers kind of touch on that, Alessandra in particular. I think one of the key things within this set of negotiations were that governments are kind of pulling back a lot on their health budgets. And so how is it that we make the best of very stretched, limited resources? And I think in terms of navigation and opportunities moving forward, the health sector also has a really unique set of experiences, particularly around things like fossil fuel subsidy, because there is track record on things like alcohol taxation and tobacco taxation, removing subsidy and actually very closely regulating those market actors. So I think there's also a body of evidence and a body of advocates and advocacy history that we can definitely draw on to try and make some of that happen. But thanks so much. I hope that answered your questions.
Absolutely, Rosie. And I mean, I wish we had more time because I think this is like such a fantastic conversation and so important. And I did commit a cardinal mistake of assuming that everybody understood what this WHA was. It's World Health Assembly. It's the upcoming 77th World Health Assembly, which is going to be held in Geneva next week. And a resolution on climate and health is likely to be passed, as Rosie said, touch wood, it should be. Rosie, I would like to invite you in the chat to share some more background information on this, and especially the press release that has been issued yesterday, which has more detailed information, and that would help inform our audience better, and also give them availability of how they can amplify this message. My last but not the least panelist and question to the panelists is Jess. And you know, at the CAN Health Working Group planning meetings, we always break our heads together to ensure that health considerations are integrated in the UNFCCC negotiation and is seen as foundational consideration. What are your expectations of the upcoming SBs, and how do you see, how are you seeing, what are the strategies that we can implement to ensure that health remains central focus in the climate discussions?
Thank you so much, Shweta, and thank you to everyone for staying with us this far, and to the amazing work of the translator too. Thank you, Paz. For background, in case anyone is not familiar with it, we are going to move now from climate and health policies to health and climate policies. And SB 60, like Shweta just mentioned, is the halfway point negotiations to the COP each year. It takes place in Bonn in Germany. This year it's from the 3rd to the 13th of June, so directly after the World Health Assembly. And it doesn't get as much media focus as COP does, but it's a series of preparatory negotiations and workshops in the lead up to COP. It enables countries to figure out the positions of one another and to begin to develop draft texts that can then be negotiated at COP and agreed on there. So we heard earlier how health is a foundational rationale for ambitious climate decision making, and we know that the best outcomes for health that can come from SB 60 or from any climate negotiation process are those that are aligned with what the wider climate community is calling for. Ambitious climate decision making is exactly what we need to protect health. And we've seen a growing focus on health across UNFCCC constituencies, and we're really excited by that. So as well as the CAN Health Working Group, there are also health thematic groups in Ringo, the research constituency, in Yungo, the youth constituency, and in women and gender. So what are we hoping to see on policy in Bonn and in the lead up to COP29 and beyond that as well? And in thinking through this, I'd love to unpack a little bit of what we saw at COP28 in addition, and to think about what the barriers are there to translating any of this into reality. So as Pooja mentioned at the very start of this discussion, health relevant indicators are now being developed for the health target of the framework for the global goal on adaptation. There's some initial work that needs to be done to figure out the timelines exactly for that work and what technical discussions will take place when, but by COP30, we will have a dedicated set of health indicators to measure progress towards adaptation in the UNFCCC process. It's really key to note that finance is going to be essential for enabling progress on adaptation. It's not very helpful to have detailed indicators if there isn't finance to support progress towards the achievement of the indicators, and that's something that's been really contentious in the UNFCCC space. There's often very generous funding, or that's the wrong word, there is often more generous funding from developed countries to fund mitigation and emissions reductions than there is for adaptation, which is what low and middle income countries need absolutely the most urgently. And there are huge shortfalls in climate finance overall. When we think about health and just transitions, which also came up earlier in the call, just transitions apply across any sector in energy, in agriculture, and again, means of implementation from high-income countries to enable those transitions in all countries is going to be vital. In energy, we want to move away from fossil fuels. We want to be maximizing the health gains of clean air from renewable energy. We also need to protect people's jobs because we know that that is such a huge social determinant of health. And we need to avoid the repeated impacts of fossil fuel extraction when we're procuring critical minerals for solar panels or for batteries for renewable energy infrastructure. In agriculture, it's so clear that we need to shift away from industrial agriculture, which doesn't serve all people, is associated with highly processed food or more meat-intensive diets. We know that those are associated with poor health outcomes. To speak a little more about agriculture and how that's featuring in the UNFCCC negotiations, food has recently become part of what was formerly a discussion that was focused only on agriculture. Historically, the focus there, rightly so, has been very strongly on adaptation. There is a lot of contentious discussion, or at least there was at COP28, on whether mitigation could also be part of this discussion on agriculture and food and climate change. There's been very, very strong pushback on this, even though mitigation and healthy, sustainable diets has been identified as an opportunity by the Intergovernmental Panel on Climate Change. This hasn't yet been addressed, and we probably will hear much more about it in the lead up to COP30 in Brazil. Also really important to flag that this discussion on mitigation in food and agriculture is hugely more relevant, as with the fossil fuel discussion. The pressure should be on the highest income countries to mitigate fastest and most rapidly. We heard from Lily about the threats of dangerous distractions and the dangers that these pose for health. The fact that carbon capture and storage was mentioned at COP28 is testament to the interference by the fossil fuel industry. There were 500 representatives from the fossil fuel industry at COP26, there were 600 at COP27, and there were 2,400 at COP28. So to see any of this translated into action, it's really key that the health community becomes more sophisticated in the way that it works around the fossil fuel industry and in the way that we call out their tactics and their strategies. On finance, the issue that's needed to address any progress in any of these other areas, we need existing finance to be spent better to maximize the co-benefits that we see across climate change and health, and we need more new finance. We can't just relabel finance and direct it away from other areas where it's needed. To take finance away from humanitarian action in favor of climate and health would undermine progress on health and other climate losses and damage, and addressing other climate losses and damages. And finally, we really need to see health in nationally determined contributions, not just as a name check, because name checking health is not sufficient to protect health, but framed in nationally determined contributions in ways that is really tightly linked to ambitious climate action. Thank you so much, Retta, and I'll pass back to you now.
Thank you, Jess. I mean, you make a very, very seemingly complicated process look very simple. I'm sure there are different layers, and we can probably do hours and hours of calls just to kind of dissect some of these layers and understand it better. But I mean, I know I'm conscious that we are at time, and I'm requesting everybody to just stay on for 5 more minutes, because I have one and only one follow-up question to all my panelists and a request. The follow-up question is that June, July, August seems to be like really, really crucial when it comes to policies and policy conversations, be it C20, G20, World Health Assembly, and Bonn. How do you see the civil society groups complementing, or where are the opportunities to support and amplify some of the complicated hoops that are out there? Where do you see the civil society really supporting, and where are the opportunities? Just really, really quick thoughts. And it's okay if you don't have, because I have a follow-up request that probably will give you more time to think about it. Let's start with Rosie, and then Alessandra, and then Jess.
It's a really good question. I mean, I think one of the key things, particularly for WHA, is bridging the spaces. A lot of the people who are going to be at WHA are health focused. And so actually having people like Jess, Kurt also had some great comments. I've seen some fantastic items in the chat. Being able to engage and sort of bridge those, make those connections and encourage really strong health arguments to complement the climate arguments we have to overcome some of those economic, social, and political barriers, concerns, and make those arguments more compelling, I think would be really, really important.
Thank you. Alessandra, as the Civil Society 20 Sherpa, what are your thoughts? You must be asked this question many times, so do share your thoughts with us.
Thank you, and thank you very much for all presentations. It was very informative. Thank you. I think we need to create definitely more synergies, and some of the synergies are happening at the UN level in some of other forums. So, for instance, the Summit of the Future, it is a moment, it is a place where some of the issues that we are addressing here will be covered. And also, I think that we need to focus not only in the content, you know, in what we want to see in terms of resolutions that will come up with policies and services for our people, but also in the means of implementation. I would like to insist on that, because if we don't have a budget, none of the recommendations will be implemented. And for me, this is a really key point at this stage. But the other thing that I think we need to create more synergy, it's to bring also the issue of course of key populations, because some of things that we discussed here, we have been advancing in terms of recommendations or resolutions, but you see the gap remains on some of the key vulnerable populations. So I think we need to take a look on that. And at the global level, when thinking in terms of the geopolitical approach, we cannot forget the war economic we are facing at this moment. I'm saying war economic because I'd like to reinforce the level of investments in the current wars that we have so far. Political momentum is very complicated. We see the rise of ultra-right movements that will jeopardize everything that we are saying here. They are denying the rights for health, education, sexual reproductive health and rights, etc. But at the same time, they are working against the evidence that we need to push forward within the WHO, and at the same time they are denying the climate change as a crisis in general. So I think we need to have more this global perspective and to see that none of us will achieve what we need alone. And this is very important to have this opportunity of bringing together two strong movements, because health movements and climate movements, I think, are very powerful. But we need to think strategically how we can reinforce our, let's say, in common recommendations to face the challenges before us.
Thank you so much, Alessandra. You so beautifully said that how we need to break the barriers and come together and be unified in our demands. Jess, your thoughts?
I would love to expand on that and just make it very specific to the UNFCCC context. As the health community coming into the UNFCCC space, it's been a real journey to try and navigate the different policy discussions that are ongoing, and it's been so invaluable to work with members of the climate community that already understand those spaces and to figure out where health can be integrated in a way that's really constructive and not as an additional extra or an add-on, but something that is really central to the climate movement and is phrased in a way that makes sense to the negotiators that we're trying to work with and influence and support their own ambitious decision making. Thank you.
Thank you so much. It's my second part for you all to consider, and especially my three panelists, and it's been incredible to just like learn from you, is that as part of this big tent call that we are calling this, the next part of this call we would like to host in July. Maybe we can still figure out the date. We've not thought of it, but the idea was that after the World Health Assembly, possibly a great resolution, after the C20 meetings, and after the SPs, I think it's important to understand what the experience had or has been, and what are the points, how we follow up from this. So this doesn't become like a standalone one conversation. So we would really like to invite our three panelists back in July to learn from your experiences. But more importantly, this is a message for all our participants that we don't intend to be a one-off conversation. We intend to continue these conversations because these are huge opportunities for us to learn, to understand and build those coalitions, understand who else is in this space and how we can collaborate. So we would like to do that, and we will have our follow-up call possibly in July, and we'll keep you all posted. I know that my colleagues have posted some website links and spaces for more for you to learn and understand more deeply about these processes in the chat. So do check it out, and we will be happy to share the recording of this meeting with all the participants once it's ready. With that, I really want to thank all the panelists and my co-moderator from the first panel, Andrea. This has just been a very, very insightful and amazing conversation. And thank you for taking this time. And I look forward to continuing this conversation in the coming months. Thank you so much.